Many of you have been in the position of being in a new country and not speaking the language, and then you get sick. Okay, I know what's happened to me. I've been traveling, I get sick, I have to go to the doctor. What's the first thing that goes through your mind? How am I going to communicate? How am I going to explain what's wrong?
We really want to get away from untrained interpreters out in the community, family members interpreting, things like that, and we want to move towards, as a county, really well-trained people going to every medical appointment out there.
Here we are so close from Mexico, so it's a lot. I have phone calls every 5 in the morning because they need to be there for surgeries. It's a lot of demands.
There's sometimes questions that patients do not understand, or they haven't heard that word, or they don't know, probably they know what it means, but exactly what they want to make sure that what they thinking is what it means.
SIT is a method that many interpreters use to introduce themselves. It stands for confidentiality. I use the first person. I'll be managing the flow of the session, and everything you say will be interpreted.
We're giving a 40-hour training to interpreters that want to work in the mental health field. So some of them are already working in the field and want to refine their skills. Others are bilingual, want to learn what it's like to be an interpreter. So this is kind of a good first step towards that process of becoming an interpreter.
I would like to impact a little of my community, letting them know that there is help and assistance, that I could help them and with that translation, and make sure that I know the words, that I know the vocabulary.
When people bring a family member or a friend as their interpreter to especially a mental health interpreting appointment, as you can imagine, they're not comfortable to share really what's going on with them. So having a neutral party that's competent, knows their stuff, that's a really powerful way for people to feel comfortable with their providers and open up and address some deep-seated needs that they might have.
And in San Diego itself, we have about a little over 100 languages. That's a lot of languages here, right? And all those languages need interpreters.